Dear colleagues, enjoy your meal, enjoy your lunch, and now let me entertain you a little bit with some aspects of our research on optical tomography. Well, I think you all agree that optical imaging is broadly established in preclinical research. However, if it really comes, and Freek already mentioned that, to a detailed biodistribution analysis, PET and SPECT are usually preferred as they are more accurate and quantitative. So the question that we ask ourselves is, can optical imaging become a complementary tool for preclinical biodistribution analysis? I think this is really desirable, as optical imaging is a quite cheap modality. You have no radiation hazard, and you can have a very high animal throughput. But for that, we need to overcome some limitations of optics with respect to scattering, absorption, surface dependence. So generally, the quantification is not easy. So the first important thing is that we choose the right wavelength for the optical imaging approaches. And this is already a quite old image from a publication of Ralf Weisleder, where he showed the absorption and scattering properties of light in the tissues. And I think it's very obvious that we have lowest values in the near infrared, so somewhere between 600 and 800 nanometers. So we need to focus on that range. And most people did that and developed kind of probes and reporter genes to do optical reflectance imaging. And this is just an example that shows you that indeed optics is quite sensitive. So what we did here, that we used cells that are labeled with GFP and RFP, and we just subcutaneously implanted them. And you very nicely see, I don't know whether the laser is somehow not working, but doesn't matter. I think you see it in the optical signals that we can see these cells very reliably. We can see them better as you would see them, for example, in CT. Even the injection solution is not visible, so you have sensitivity. But what about quantitative analysis? And there you see that we completely fail, that if you compare that to MRI or other imaging modalities, that we underestimate the volumes and the growth of the tumors. And if we really monitor in an early stage tumor formation, where the cells from the injection site move towards a round shape and go deeper into the tissue, we see that it even looks like there would be a decrease in size and then an increase again. But this is really an artifact, because the light scatters in different ways up to the surface, and you only get with reflectance imaging surface information, which is not really representing really the assembly of the cells. So due to that, it makes sense to focus on tomographic approaches of fluorescent imaging. And this works in a way that you have a laser source. With a laser source, you trans-illuminate the animal, and you record multiple points, and you look to all the projections at the other side where the light comes out. And then you can take this data set by recording first the excitation images and the emission images and do a diffuse optical reconstruction to then get a 3D impression of the distribution of fluorescence. First optical tomography systems just did that and assumed the mouse of being a box-shaped, but this completely failed, because you need to really carefully consider the different surface properties of a mouse. You need to consider scattering, you need to consider absorption. And this really shows you how the impact of this information on data quality is. So here we injected a probe that is distributing in the blood, so you should see it in the heart, and you should also see it in the tumor. If we only consider the shape of the mouse based on CT data, you see that it's completely mislocated. That's the first of the right images, where you see the signal is much too small. It's next to the heart, and also it's not displayed in the tumor, it's next to the tumor, so you have a mislocation. If you then take the transmission light to compensate and to calculate for absorption, it already gets a little bit better. You see now the signals are becoming located in the tumor, but in environments where you have different scattering and absorption properties, like in the heart and in the lung, you still have a mislocation. So the next step that you need to do is you need to segment the organs and then to assign scattering and absorption properties to the organs, in addition to the information that you get on the morphology. And then if you run the reconstruction based on all this information, then you get a really accurate impression about the tracer distribution now being correctly located in the heart and being correctly located in the tumor. So it was a very long road to get from the methodological developments towards a real quantification of optical data, starting from data acquisition, data reconstruction, segmentation of organs, until the quantification of organ distribution data. And as we wanted to have impact on the society, we then started to collaborate closely with MILabs here and try to implement the optical technologies together with them in their three-modal, at that time, three-modal imaging system. And for that, we won in 2018 the Innovation of the Year award at the WMIC. So how quantitative can optical tomography be in a mouse? And this is shown here, where we used fluorescence inserts in the colon of a mouse, and we inserted between 1 and 100 picogram concentrations. And you very nicely see here on this graph that we can really, with a considerably small standard deviation, determine these probe amounts on a really linear scale. The next question that we asked ourselves was, if we now compare PET MRI directly with FLT-CT, how does it compare? And in this context, we collaborated with the lab of Bernd Pichler in Tübingen and with Roche. So Roche did the histological analysis, Bernd Pichler did the PET MRI, we did the optical imaging, and we used different antibody formats that were either labeled with a fluorescent dye or they were labeled with gallium DOTA. And you see that concerning, for example, kidney accumulation, data nicely match. But you see that if you look at the liver, for example, or at the tumor, that the signals of the fluorescence measurements are much higher as compared to the PET data. So the major question was, is this a problem with the measurement, or is that a problem that is related to the probe? And for that purpose, we quantified the antibody amounts in the organs and correlated them with our PET and MRI data. And what you can very nicely see here is that indeed the methods themselves are very quantitative. So there's a real linear correlation between the FLT data as well as the PET data. So that means it's really the probe that makes a difference in biodistribution. And so we thought, okay, let's have a deeper look here, how optical probes impact on biodistribution of biomolecules. And in this context, I don't want to say too much about it because there's a poster here, poster walk 21, abstract 65, where you can see it in detail presented by Sarah Schraven. But I just want to give you a little bit of preview on the results. So if you only look at, for example, 4 prominent near-infrared dyes, which are frequently used in preclinical research, you see that if you inject them and measure their distribution, they strongly differ. So some have rather a liver uptake and a hepatic elimination. Some are really small, more hydrophilic, and leave via the kidney. And there's even postulation that some of the optical dyes have a receptor-mediated uptake, for example, via OATPs or estrogen receptors. So as we now know that there's a big difference, the question is, does that impact also if we take such a dye and use it as a label of a polymeric drug delivery system? In our approach, we use HPMA. Yeah? And what we found is, yes, this is the case. If you compare, for example, tumor uptake, depending on the dye, you have a difference in uptake by a factor of 3. And it also strongly impacts the elimination of these polymers, whether it's rather via the kidney, because they are still small, or whether it's rather hepatobiliarly. So you need to be careful. You need to choose the right dye for these optical probes. There need to be more research on understanding the impact of these labels on the probes and on the biodistribution. But if you consider that properly, you can do great things with these kind of devices. And there's another poster here at the WMIC, the EMIM presented by Ilaria, where we investigated how we can predict the success of nanotherapies based on the accumulation of the probes and whether the heterogeneity of tumor accumulation changes over the course of treatment. And in this context, we could nicely show, yes, indeed, we can clearly say that if at the beginning there's a high accumulation of the probes, you have a better response to the treatment. And interestingly, we found that over the course of treatment, the heterogeneity of accumulation increases. And this, of course, may also give you a hint about possible resistance that develops inside the tumors and gives you the option to do co-medication, for example, to prime the microenvironment to have a more homogeneous response. Yeah, this is already what I wanted to show you in my short presentation. I hope I could convince you that FLT-CT is a quantitative method suitable for biodistribution assessment of larger molecules. I think it's a very valuable tool for drug delivery research and for research on any kind of nanomedicines. It is indeed sensitive in the picomolar range. In our measurements, just about 1 order of magnitude in the sensitivity below PET. However, we need to admit, in some organs and regions, you still have problems with fluorescent crosstalk between organs. If there is a high discrepancy between the tissues in scattering and absorption, sometimes quantification is a little bit more difficult. But most importantly, I think, if you do optical imaging, also look at the dyes that you use. Consider that the dyes will change the pharmacokinetics, even for such large molecules like whole IgG. There is an impact, and you need to know it in the interpretation of your results. And yeah, I think if I would be allowed to have a wish on the system, which I think it's really a great system, but I think optical imaging is really a very potent tool. And I think you can not only look for pharmacokinetics. If you would have multiple lasers in such a system, that would also allow you for multiple analysis at the same time. You could, for example, use it on the one hand to look for drug delivery, at the other end look for a reporter gene expression by cells that were transfected previously, maybe even in combination with bioluminescence. And don't forget, it's also one of the most sensitive tools to assess enzyme function by using activatable probes. And if you bring that all together, you have really a great, powerful tool in basic research. With that, I would like to end. I thank, of course, Freek and MILabs for the great collaboration over many, many years. Yeah. But I would also like to thank all my team that generated the data, and also particularly Felix Gremse, who developed all these optical reconstruction tools. And I thank you for your attention and will be happy to answer questions. Thank you very much.